The Lindsay Clancy trial is curiously moving in a direction that the prosecution likely never intended, where they're accidentally demonstrating major dysfunctions in our mental health care system. We're going to be breaking down how the evidence in this case seems to be exposing those serious dysfunctions. So now, let's get started.
A seemingly picture-perfect family enjoying a trip to the Science Museum. The day of, Lindsay sent her then-husband Patrick Clancy this photo of her kids playing in the snow.
Patrick to Lindsay, you're a good mama. Lindsay to Patrick, smiley face with hearts.
The defendant made a calculated decision. This was a woman who no longer liked the life she thought she wanted. It was getting harder and harder to control. And when she saw the opportunity to escape, she made the selfish choice to take it, and to take Cora, Dawson, and Callan first. This was a woman who acted intentionally, rationally, and swiftly to accomplish a very specific goal: to kill.
On the night of January 24th, 2023, Lindsay Clancy sadly annihilated her 3 young children before attempting to do it to herself. First with a knife and then throwing herself from her home's second-floor window, leaving her now paralyzed from the waist down.
She moves the bed away from the wall, away from the window. She opens that window and goes out. She lands on the cold, hard ground.
However, the question before the jury that they're going to have to decide in this case is, did Lindsay go psychotically insane to do this or not? It's common for many to think that if someone's found not guilty by reason of insanity, they get to immediately walk free. However, that's usually not the case, where she will likely spend most, if not all, of her life in a long-term psychiatric unit. However, if she's found guilty, she will spend the rest of her life in prison. Although both scenarios involve Lindsay being put away long-term, one focuses on treatment, while the other is intended to be punishment. The prosecution's case is that Lindsay deliberately created a window of opportunity by sending her husband Patrick out of the house to pick up dinner and medication for their child.
A male voice. A voice that she had never heard before, a voice that she never heard again. And that voice told her that it was her last chance. That she had to kill the kids so that she could kill herself. She immediately took action when she heard the voice, with no direction or details from this so-called voice.
They claim that Lindsay saw the opportunity to do something horrific and she took it.
There is no dispute that she was dealing with mental health issues during this time period, prior to the murders.
Lindsay Clancy, a former labor and delivery nurse, had been struggling with serious mental health problems and repeatedly sought help in the months leading up to the killings. And the deeper the prosecutors get into that history, the more the jury is hearing just how convoluted our mental health care system is.
Medical record from women and infants saying that they called Rebecca Gelada and never got a call back. Your memory is that they never called you?
They never called me. I absolutely would have called them back.
Lindsay repeatedly sought psychiatric treatment, was prescribed dozens of psychiatric medications, was hospitalized at some of the most respected mental health hospitals in the world due to reported depression, severe insomnia, and harmful thoughts, and was treated by multiple psychiatrists and providers who had graduated from some of the best universities in the world, many of which are in that Boston area.
I'm a licensed marriage and family therapist.
I'm a psychiatrist. I'm a licensed mental health counselor.
I'm a psychiatrist.
I'm a psychiatrist. I'm a psychiatric nurse practitioner.
I am a psychiatric mental health nurse practitioner.
I am a forensic psychiatrist.
It seems that the majority of these witnesses in this trial are doctors, psychiatrists, and mental health providers. Yet many of those apparently very well-educated doctors and providers did not seem to have a complete picture of what others were doing, and seemed that they were all playing a 6-way prescription tug-of-war with Lindsay's mind by continuing stopping, changing, and adjusting many of her prescriptions, so much so that Lindsay had basically become a walking pharmacy.
Clancy had 30-plus prescriptions for 13 different psychiatric medications, all provided in the 4 months before the killings by at least 5 different prescribers.
Lindsay wasn't working with just one psychiatrist who knew her entire history, followed her closely over time, and coordinated every aspect of her treatment. Instead, Lindsay had numerous doctors and providers involved in her mental health care. Sadly, what's being highlighted here with Lindsay Clancy at trial is not at all uncommon in mental health care.
What is polypharmacy? What does that mean?
Polypharmacy?
Yeah. You ever heard of that, polypharmacy?
I've heard of it, but not sure of the exact definition.
Okay. Is it something to do with having too much medications thrown at you all at once?
Polypharmacy generally refers to a patient taking 5 or more medications simultaneously, and it becomes especially complicated when several providers are involved in prescribing and managing those medications. The more psychiatric medications involved, the more difficult it can become to determine which medication is actually helping and which may be causing side effects, whether medications are interacting with one another or whether starting, stopping, or rapidly changing medications could be contributing to any new symptoms.
Individuals have very varied responses to medications. Some have no side effects, some have 1 or 2. It's impossible to predict.
And as you can imagine, the effects of psychiatric medications aren't simple. If a patient's symptoms are getting worse, is that an underlying mental illness progressing, or is it related to a medication change? If she suddenly can't sleep, is that another symptom of her psychiatric condition, a medication side effect, or both? If her thinking or behavior begins to change, is the original diagnosis still correct? Has another medication interacted with the other, or has something new or serious started to develop?
Are you supposed to tell a person that's on an SSRI to stop immediately or to slowly withdraw from it?
At 50 milligrams, it is perfectly fine to stop it immediately.
So you didn't have any concerns at all about telling her to immediately stop taking the Zoloft? And what did you do, put her on another drug?
I did not feel that it was necessary to document the specific side effects.
Basically, it can become difficult to know if they're treating the illness's symptoms or piling more medications to treat the side effects of all the medications. And as you can imagine, with a massive polypharmacy, it can be sometimes difficult to know where the patient's symptoms of their illness end and the medication side effects begin. Have you ever heard of the old lady who swallowed the fly nursery song?
There was an old lady who swallowed a fly. I don't know why she swallowed a fly. Perhaps she'll die.
She swallows a spider to catch the fly, and then something else to catch the spider, and it keeps escalating until the attempted solutions become a much bigger problem than the original one.
She's dead, of course.
It illustrates the concern with a poorly coordinated polypharmacy. One medication is prescribed for one symptom of an illness, another is added to address a side effect of the first medication, and then those meds may develop a bigger side effect, so more medications are introduced, which cause even larger adverse changes, leading to even more medications until they're taking dozens of medications, all because of a relatively simple illness that the provider was attempting to treat. That's of course not always the case, but especially with psychiatric illnesses and psychiatric medications, it's sometimes very difficult to know what those medications are exactly doing in a person.
Did you talk to Tufts?
No.
Did you ever get access to Tufts' medical records?
No.
Do you know how many times she saw Dr. Tufts?
I do not.
Would it surprise you if I told you that she saw Dr. Tufts 14 times in the time frame of October, or the end of September, October, November, December, and then January, 4 months?
Yes.
Also, when care is divided among numerous providers, each clinician may only be seeing a small snapshot. For example, one provider treats the insomnia, another treats the anxiety, another changes an antidepressant, and someone else evaluates the intrusive thoughts. Each individual decision may make sense on its own in its own siloed world, but may cause the patient's overall condition to deteriorate.
Do you think possibly that she's over-medicated? Do you think somebody screwed up and she says it's possible? And then she puts her on more medication. She puts her on, okay, December of 2022, you're going to see that Nurse Gelada, who is now on this chart, is in blue. Nurse Gelada puts her on quietapine, 25 milligrams, November 30th. December 6th, diazepam, 5. December 7th, diazepam. December 7th, quietapine. December 9th, diazepam, 5. December 13th, diazepam.
And with so many providers involved in her care and so many changes that are being made, no one was taking a step back and looking at the entire big picture and asking, does she need to be on all these medications? And why isn't she getting any better? This alone does not necessarily mean that she's not guilty by reason of insanity, because a lot of patients unfortunately go through this.
We asked her, how are you feeling? Horrified. And then she wrote down, do I have an attorney?
How about the cops? How many cops were there?
I don't recall.
There were some, right? There were armed men in that room, were there not?
And surprisingly, this type of polypharmacy and fragmented care actually benefits the doctors. Can you guess how? Yes, first, of course, there's a lot of providers who are getting paid, and that's always benefiting the providers. However, there's also something else. It's because when responsibility is spread across multiple providers, no single person owns the entire treatment plan. Therefore, if something ever goes wrong, it diffuses their responsibility, where accountability can become just as fragmented as the treatment itself. Let's think about it. If there's only one doctor, it's easy to point responsibility if something goes wrong. However, as the number of doctors and providers increase, it becomes increasingly difficult to isolate and then prove in a court of law who is at fault.
Defense attorney Kevin Reddington in cross-examination took sharp aim at Dr. Jennifer Tufts, the psychiatrist who issued nearly half of Clancy's 30 prescriptions.
Why would you prescribe Zoloft to a young woman who's postpartum, who's coming to you with anxiety, who's telling you she can't sleep, she's got all of these symptoms, and you prescribe a medication that would have a side effect of trouble sleeping?
Individuals have very varied responses to medications.
From September 2022 until the day before the murders, Lindsay Clancy had 14 telehealth appointments with Dr. Tufts.
Yes.
Over that time, Clancy's anxiety and depression worsened.
Additionally, many of Lindsay Clancy's outpatient psychiatric appointments were via telehealth. So how might that have limited her provider's ability to fully evaluate her?
Say hi, how are you, and give a handshake when you came in your office?
It was telemedicine.
It was what?
Telemedicine.
Telemedicine.
Right, although providers can still perform some basic type of follow-up type of mental health status examinations on a video call, they're only seeing the patient through a very narrow lens of a few minutes, with sometimes hundreds of patients that the provider has on their caseload. Therefore, they may be able to notice just obvious problems, but they are less likely to observe the patient's entire presentation, where they may not have noticed or smelled that the patient hasn't showered or changed their clothes in weeks.
That there are objective manifestations that patients may have that would be a tell, like if you're playing poker, you have a tell, that would be an indicia of the fact that they're stressed or emotionally disturbed, right?
Yes.
Like hand wringing, right?
Yes.
Were you able to see the hands wringing when you were on telemedicine?
I don't recall seeing her hands.
And on a video call, the provider will likely not be able to see the condition of the patient's hands, legs, and feet very easily. What else do you think the provider loses while just on a video call with the patient? Yes, they lose some of the subtle behavioral observations that come from watching a patient walk into their office, interact with staff, sit in the waiting room, and generally function outside of the controlled frame of a video call in the privacy and comfort of their own home. Those details can matter when a psychiatrist or a provider is looking for signs of self-neglect, psychomotor changes, disorganization, or overall deterioration in functioning.
There was some therapy incorporated in our sessions,
like
but
what?
we did.
Like what?
Providing emotional support, listening to her. I listened to her. I listened to her concerns and provided support. I tried to provide her with hope that eventually things would improve.
Additionally, the so-called therapy that the psychiatrist provided Lindsay Clancy seemed to be more of a cordial check-in than an actual in-depth psychotherapy designed to explore her thoughts, processes, intrusive thoughts, changes in behavior, and deteriorating mental state.
I mentioned that I provided supportive therapy.
What is supportive therapy?
It's listening to the patient's concerns and providing emotional support and validation.
However, with just a few-minute video call, there's only so much meaningful psychotherapy that can realistically take place. Unfortunately, this type of video conference telehealth is not uncommon in mental health today. Although telehealth can be very convenient and brings a lot of people to actually even get help in the first place, there does appear to be something that is lost, especially those who are experiencing more severe mental illness. But keep in mind, this is just all my opinion involving this case and is not advice at all.
I believe our first visit was September 15th.
Of
2022.
You were practicing as a psychiatrist for a little more than a month.
Additionally, Lindsay's psychiatrist, who looks about 12 here, was only about a month out of psychiatry residency when she started treating Lindsay and seemed to advertise that she was a specialist in postpartum.
Admitted she never treated a case of postpartum psychosis before she met Lindsay Clancy.
Why did she come to see you? According, not guessing and speculating, never mind the TV. You just look at your notes. Tell me what brought Lindsay Clancy to your office.
Postpartum anxiety.
Since postpartum psychosis is extremely rare, that raises an important question about whether Lindsay Clancy may have believed she was receiving specialized postpartum care and expertise, possibly resulting in the very young and inexperienced psychiatrist missing clear warning signs and symptoms. However, my point in all of this is just that the mental health system as a whole definitely is very dysfunctional, and these issues with the mental health system are not at all exclusive to the Boston area. This is a national type of issue that I think we're noticing with mental health.
Unfortunately, despite what the public might believe, a lot of psychiatry is trial and error, trying to figure out the right medication for the right patient.
As you can imagine, psychiatric medications are not a simple on and off switch where a doctor prescribes a med and a predictable result always follows. They often alter complex brain systems, people respond differently to them, and starting, stopping, combining, or rapidly changing medications can sometimes produce significant adverse effects. If, for example, your close friend is put on the wrong psychiatric medications or given a combination of medications that interact adversely with one another, the resulting changes can be shocking, turning them into someone you may not even recognize. We, of course, don't know if anything like that happened to Lindsay Clancy, but taking those
30 plus prescriptions for 13 different psychiatric medications, all provided in the 4 months before the killings by at least 5 different prescribers,
is wild and is ridiculous that it didn't seem like any of her providers thought that was a bad idea. It just seems that no one was ever really questioning whether she should be on all of those medications or not. Due to Lindsay's attempt on her own life, she's now permanently paralyzed from the waist down and must live much of her life in a wheelchair.
She had her neck stabilized with a cervical collar, and she had an intraosseous catheter, which is a type of IV they put directly into the bone on her right lower leg.
Also during the trial, Lindsay was seen sobbing, crying before becoming visibly overwhelmed as the medical examiner described how her children sadly died.
What about injuries?
All right, counsel, we're going to take a break this time, all right?
All right. George, close your notebooks. Place them on the chairs, please. Let's wait for you.
Whether those emotions were authentic or performative, they do align with the defense's portrayal of Lindsay as a mother who loved her children and whose actions that night were the result of a catastrophic psychiatric breakdown.
The loss of consciousness.
It's obvious what she means. No, overall, you can ask.
It would just make it occur faster.
Combined with the permanent consequences of her actions of now being paralyzed, the jury may see Lindsay as someone who is already living with an enormous punishment for what happened that night. Do you think the emotion Lindsay showed in court was genuine, and should any of this matter when the jury decides her fate? Now in the comments, why do you think Lindsay Clancy should be sent to prison for life or a mental hospital? Let everyone know in the comments below. Subscribe for more, and if you want exclusive content and channel perks, hit that join button now below, because your support makes all of this possible. Whether you agree or disagree with Lindsay Clancy's not guilty by reason of insanity plea, this case demonstrates many of the dysfunctions in our mental health care system. And this happened in New England, home to some of the most respected hospitals, medical schools, and psychiatric institutions in the entire world. Therefore, fragmentation of care, poor coordination between providers, massive polypharmacy, short appointments, and potentially missed warning signs can all happen within a region with this level of medical expertise and resources. Imagine how much more difficult it can be for patients receiving care in communities with far fewer resources and specialists. See you next time. Remember, this video provided educational and analytical commentary opinion based on psychological concepts for entertainment purposes only, and does not reflect the views of any employer or educational institution. It was not clinical advice, diagnosis, or treatment. Please consult a licensed professional for mental health concerns.